As I said, I'm the admissions tutor for health economics and policy. We have a lot of students coming from all around the world. Most of our students are not. We have some students coming from Asia, Middle East, Africa. Some are also based in Europe and North America. As all the other programs we are presenting today, this is a two-part PhD program. We have a component that is usually completed within 24 months, and then the part one, it corresponds to the first 2 years of your PhD, and it is spent acquiring the skills you will need to progress successfully onto the research phase. Here I have the third component of the PhD in health economics and policy. We also have an MSc program, and the difference between the MSc and the PhD is the modules that the students enroll in year 2. So the modules that's taken in year 1 are exactly the same for the PhD and for the MSc. So we start with a module on health economics, principles and practice. Then our students have the data analysis module, and then we have another core of health economics that is applied health economics. And our program in health economics is different from the other PhD program. And this is also these are also the top modules that the MSc students take in the first year. In the second year, all our students, both the PhD do the systematic approaches to literature reviewing and evidence synthesis in the Michaelmas term, and then the PhD students do a module on research philosophy and principle of research design, and the students that are enrolled in the masters, they use these 2 last terms to complete their dissertation. In the health economics principles practice model, it is taught by myself and Professor Bruce Hollingsworth. We tackle topics as a global review of health economics, some basic terminology and macroeconomic tools for health economics, some statistical tools, health systems around the world, the demand for health and health care, production and supply and demand, economic evaluation, and the role of economic evaluation in health policy. These topics are dealt with more depth than the other core module that's FTech, that is the 409 module, where we usually look into more detailed in health economic evaluation methods, and we also do readings on papers that have been recently published, and we use those papers to discuss with students and also to teach students about methodologies that are suitable for them to learn, so they can use them in their research phase. What can be covered in the topics that we know? How is healthcare delivered in different countries around the world? Variations in medical practice, the different healthcare situation, public health interventions. Is health something we choose? The demand for health and health care. How do we measure costs and benefits of health technologies? So we look into things like cost effectiveness. How can we measure health-related quality of life, and purposes of economic evaluations? In the research phase, usually students take 36 months, the minimum is 24 months, and the maximum of 6 months. In fact, most of our students in health economics and policy, they are taking around 5 years to complete their PhD, because they work full-time, they have their own families, and we are also very keen on keeping a good work-life balance and not having students burning out at the end of the research phase. So the 5 years length is the average so far. So the second stage of your PhD spent researching and writing up, and students progress to the research phase of the blended PhD programs and join an active research community of staff and students. So what do we research in health economics and policy? So our students have regular expert supervision with colleagues across the university. For instance, I'm currently supervising students with colleagues working in the economics department, in the philosophy department, and in maths and stats department. Because these are the teams and the combination of skills that best serve the interest of the students and topics that they have selected for their research. We also have a PhD research seminars that is an international PhD seminar series. We do it together with students enrolled in the PhD in economics at Nova School of Business and Economics in Portugal. There is a collaboration between Lancaster University and Nova University in Portugal, and we have very strong links with our colleagues working in health economics at this university in Portugal. So our students present in this seminar, and then they get feedback and a discussant from Nova's students in Portugal, and they also become students. They also have the role of discussants when we have students presenting from a Nova PhD program. We also run a seminar series with national and international speakers, and all presenting cutting-edge research. So this means that more or less every fortnight we have a seminar, and intercalate research seminars by established researchers and academic seminars where PhD students present and discuss their work. We also have regular training events and advanced training to develop specialist research skills. Current areas of research include economic evaluation of health interventions, global health, economic determinants of health and health behavior, health and labor supply, health and capital, and health-related quality of life. Stuff that you also can find in our website is by Bruce Hollingsworth, with Flip, Katarina Young, myself, Saurabh Singhal, and Eugenia Zucchi. In terms of research outputs and works, I can give my own example. In the last 2 years, I have co-authored more than 25 papers, 4 reports and chapters. We work in a very intense research-led environment. I have been awarded 5 competitive research grants, and as Health Economics at Lancaster, we are involved in national and international scientific societies. We are involved in the Health Economics Study Group, that is the Health Economics Association. I'm the president of the Portuguese Association of Health Economics, and we are also involved in the European Association of Health Economics and in the International Association of Health Economics. So we have a very extensive and worldwide network. Papers that I have co-authored, the students that I've supervised, I have here just a couple of examples of papers that have been published in the last 2 or 3 years. So I'm very proud of this paper that was published in August 20, that has already reached over 45 citations since it was published. First author is the first MSc graduate of our MSc in Health Economics and Policy, and this shows how we support our students into becoming researchers. Yeah, I have also another example of papers that I've published and co-authored with a PhD student. And this student, he has published 5 papers before he had his viva and his PhD program. So this is not what we have as a goal. This is very unusual, but this, I think that this clearly shows that we support our students into becoming independent researchers and producing high-level and high-quality research that is recognized as such by peers. Why is it a good idea to enroll in an or MSc in Health Economics and Policy? It is an applied and varied course. It applies economics to health, healthcare issues, and health policy. You will gain skills on mixed methods that is becoming more and more necessary in health economics and policy. So you are going to gain research skills on quantitative and qualitative research methods. We have very experienced staff involved in the delivery of programs and also in supervising our students. This is an international environment. You can do it at your own pace, and it provides excellent career opportunities. So please let us know if you have further questions. We would like to get in touch with you. Any questions you might have. Thank you very much for your time and for your attention. And I hope that this presentation give you a brief overview of our program. Thank you very much.